true. Well, many people in the early stages of dementia struggle in conversation. They might have trouble recalling words, identifying locations, or remembering people's names.
Today we're here with Sarah Simon, a speech therapist with SSM Health, to talk about how speech therapy can help people with dementia gain communication tools before the disease progresses too far. Thank you so much for being here today.
Thank you for having me.
So when communication skills diminish, what impact does that have?
The social impact is huge. Not being able to follow a conversation or difficulty coming up with the right words, that can play a significant impact in a person's ability and desire to communicate, which can cause feelings of anxiety, depression, frustration. Not being able to engage socially can be incredibly distressing and really isolating for the person with dementia, but also their family members and friends.
Yeah, absolutely. So what do people with dementia learn in speech therapy that really makes a difference for their quality of life?
Yeah, so speech therapy is really targeting maintenance and really trying to maximize the person's ability to participate in meaningful activities to them. So some examples of strategies can include environmental modifications like putting labels or signs around the person's home, external memory aids such as calendars, planners, checklists, and pill reminders, and then some compensatory word finding strategies. And these are strategies that the person can use while they're communicating if they can't think of the right word, or to help them find that word and to kind of give the listener cues. They can use strategies such as visualization, descriptions, and gestures to try to get their communication and point across.
It sounds like something that could be really helpful for people with dementia, but it's not for everyone in the disease process, just really early on.
Yeah, so it's typically more beneficial when the person comes earlier on in the disease process, when they're a little bit more aware of their deficits and are able to use the strategies more effectively, whether they use them independently or with some mild cueing. Typically earlier on is better.
So you brought some things that can help. So can you explain what you have?
Sure. So just an example of kind of something we might do in speech therapy. We use a lot of cue cards. Some written information can be really helpful for the person. So going back to those word finding strategies, what does it look like? Where would you find it? How is it used? Strategies that the person can use, but also that a family member or friend could prompt the person to use. So for example, we might see a picture of a clock. So, it hangs on the wall, it tells time, it has numbers. Oh, are you thinking of a clock? The person would say yes, and the conversation could progress.
What else can friends and family do to kind of help with the process?
Great question. So learning communication skills and strategies to really maximize the person's communication abilities is so important. So family and friend involvement, learning communication strategies such as short, simple language, slowing down, repeating information as needed, and really allowing for response time, being okay to pause and let the person really think about and process what you're saying.
And if this is a new diagnosis for families, is there somewhere they can turn to kind of just get some resources and help?
Definitely. So there's a National Dementia and Alzheimer's Association. Certainly connecting with their primary care physician would be first and foremost. Getting a diagnosis can be helpful to open doors for additional resources, but also just the education component, which speech therapy can provide for the patient and family members as well, is really important.
Well, always such great information, Sarah.
Thank
you so much for coming back and joining us.
Thank you very much for having me again.
Yes.